So the most common knee injury that I see in my practice is knee sprains, which I see very often in the weekend warrior as well as in the elite athlete. This can be a very minor sprain, which resolves within a week or two with appropriate advice and exercise and physiotherapy, or it can be much more serious with ligament or cartilage injury, very occasionally bone injuries as well. So what I see the most in my practice is people that don't prepare for the activity that they're about to complete. So by that, I mean warming up, warming down sufficiently, which can cause muscle injuries, which can cause ligament and soft tissue sprains. And often just by treating these injuries by physiotherapy, rest, ice, compression stockings, elevation can make a world of difference. So several things indicate a more serious knee injury. So the first thing I would say is non-resolution of symptoms, the ability not to put any weight on it or to move the knee, symptoms of clicking, locking, feelings of instability and the knee giving way, I think are symptoms that should prompt people to seek specialist advice. Very minor knee sprains often don't require any treatment apart from that RICE regimen that I talked about before, i.e. rest, ice, compression elevation, and anti-inflammatory medication. The more serious knee injuries, such as the ones with the symptoms of clicking, locking, giving way, not being able to put on weight on it, the ability to not move the knee, are more worrying and do indicate more serious knee injury. So I think that depends on the type of knee injury that an individual is reporting. Different knee injuries respond better to different types of exercises. For example, anterior knee pain, which may be apparent when people are going up and down stairs or up and down inclines, often comes from injuries to the undersurface of the kneecap. There is a completely different set of exercise and rehabilitation protocol. Someone with an ACL injury has instability symptoms, and again, the exercises and rehab program for that individual are completely different. I think the important thing for me is to try and treat the patient as an individual and to try and tailor the rehab program according to their particular injury and their particular functional level.